Hi, it's Dr. Erica. Thank you for joining me. Welcome back to my channel, Dr. Erica Onigbola Farm D. It's my main channel. This is a supplemental channel that I have. Please like, share, and subscribe if you haven't already. Thank you for joining me. Today is a Mardi Gras season day, and we are celebrating here along the Gulf Coast. And I am elated to be a part of it. I went out today. I actually went out with uh, a close friend and had a nice outing this evening. Went to a restaurant, had some Italian po' boy and some crab fish dip for the first time. I also had a healthy glass of red wine to um, commemorate this uh, actual celebration of the Mardi Gras season. So I just want to pass on the energy, pass on the good vibes this season. Please check out my short videos as well if you haven't. And I want you to like, share, and subscribe to both my channels where I talk about health, delicious foods, how to incorporate pharmaceuticals into your nutritional diet, how to go about your daily routine as far as exercise, your weekly routine as far as getting into the groove of exercising, your salt intake, things like that, travel vlogging. I talk about Bible-based studies as well because I'm into getting to know deeper the book of Revelation, the book of Daniel, a lot of the prophetics that are in the biblical King James Version. So please join me on my channel. Like, share, subscribe if you haven't already. Thank you for joining me. So yes, I went out today and was able to go to a very nice restaurant here locally, and I tried an Italian po' boy, just a general, um, typical Italian po' boy sandwich. And there was crawfish dip as well as toast. And I also had a glass of red wine or Cabernet. And it was really nice. The vibes were nice. The restaurant was nice and everything. So what I really want to talk about on this video is some meds that I have in my personal pharmacy, and I want to share it with you. I have some meds or some products from the pharmacy that will help with certain disease states, certain acute issues that you may deal with from a day-to-day basis or occasionally. So let me get started. Ginger. Ginger chews or ginger sublinguals or buccal tablets are available. You can get them at your grocery store or at a pharmacy grocery, and they're called ginger chews. And you chew them when you feel nauseous, when you feel dizzy, or when you are traveling, for example. I'll show you the package. I have it here, and it is a package where I purchased it because I was curious. I heard about them before, and this package actually costs a couple of dollars or $1.50, and it's for pregnancy. If you're feeling nauseated or you're feeling like you're um, actually n- just in general over appetite maybe, or you're traveling on a cruise ship, these ginger chews is something that you might want to consider taking with you. And it is by Prince of Peace, and it's 100% natural. So it's actually just ginger. It's just ginger, and they packaged it in these candy forms, and they're chewable. And it says the ingredients include cane sugar, ginger, coconut oil, tapioca starch, and ginger. So those are the ingredients. And again, I just picked these up just because they caught my eye, and I just wanted to try them out. I heard about them before, but in the pharmacy, we generally tell patients to take pharmaceutical over-the-counter items, which include your antacids, Dramamine, meclizine, prescription, and in pregnancy, usually meclizine or Cetron, anything that is the general recommendation at the time is what I suggest. So I do want to recommend the non-prescription, non-pharmaceutical ginger chews for nausea, vomiting, and pregnancy, in traveling, in getting on a plane, traveling long distances, being out on sea, upset stomach from dinner. Any of those will render you good for those. So I have these, and I just wanted to show you those. Also, I wanted to show you in my personal pharmaceutical at home what I have, and I want to share some products, other products as well that come. I won't get too personal, don't worry. So I have earwax removal aid, which is basically hydrogen peroxide, and it comes with a bulb. It comes with a ear bulb, and I'll show it to you here. And what you do is you you squeeze this bulb, and then you take it and you open it when you insert your ear, and it draws out the liquid that you just dropped into your ear after about, I guess, maybe 5 to 10 minutes or so. And you can use a Q-tip as well. Safe, gentle, and non-irritating. It says carbamide peroxide 6.5%. And again, you can use this, I would say, maybe once a week, or just as often as you need it. It's just hydrogen peroxide or a peroxide product, really non-toxic. Earwax removal, and then the kit comes, if you get the kit, you can get the bulb with it. Okay, so just for information's sake, just know that it's available. If you're like a swimmer, or you're someone who swims a lot, then that might be good for you to use as well. If you're someone who uses earplugs a lot, someone who uses earmuffs or ear or headphone sets, you might want to go ahead and purchase one of those a box of the earwax removal as well. Children, it's good for children as well. Children might have a hard time cleaning out the ear canal, but that would be a perfect product to choose. Anyone really. And again, Q-tips, be careful with Q-tips. Q-tips are not always recommended because most people who use them end up puncturing their eardrum, having to go to the emergency room. That's an experience. So just be careful when using Q-tips and when using the bulb, because the bulb may tend to enter into the ear canal, may get too close to the eardrum. So just be careful knowing that. The next product I want to show you that I have in my collection, I have cold and flu. Cold and flu, non-drowsy daytime relief, soft gels, and they are multi-symptom, off-brand. And it is acetaminophen, dextromethorphan, and phenylephrine for headache, fever, sore throat, minor aches and pains, nasal congestion, sinus pressure, and cough. So this is another product that I have in my stash of home pharmaceuticals: acetaminophen, dextromethorphan for cough, and phenylephrine for nasal decongestion, or PE. You might see it in the market. So do be aware of that. Ladies who are out there and need or have female issues, there's over-the-counter antifungals. There's over-the-counter antifungals and pH balance material. Please watch my video about feminine hygiene products that I recommend. Um, I won't go into my personal stash. Just know, ladies, keep a personal feminine pharmaceutical pack for yourself at home, separated from your first aid kit, separated from your family's general medication, a stash of medications for your personal hygiene, like the antifungals, like the pH balance, soaps, and inserts, and estrogen, all of those feminine products that you get from the feminine aisle at your local pharmacy. Please be aware that women, we have our own pharmaceutical needs as well. And again, if you do have young ladies in your household, it's good to have a pharmacy just for ladies. So please be mindful about that. I won't share my personal feminine products, but do be aware, if you're dealing or if you have in your household feminine or females and ladies out there, be aware. Okay, the next product that I'm going to show you that I have in my personal stash, I have some hydrocortisone cream, and this strength that I have is 2.5%, which is prescription strength. There's a 1% strength of hydrocortisone cream that's available over the counter that you can pick up, called cortisone HP, or just cortisone or cortisol, or hydrocortisone. This one is by Activist. And again, hydrocortisone cream is a steroid. It is used for inflammation, it's used for pain relief, it is used topically, and it's good to keep a tube of hydrocortisone, at least 1%, that you can get from your first aid aisle in the pharmacy. And they're readily available, and they're not expensive. I'd say maybe about $5, $10 per tube, just depends. But check that out as well. Let me do a couple of more products for you that I have in my stash that I want to recommend as a pharmacist that you can try. And I have, let's see what I have next. Oh, I have contact lens cases. So I do keep contact lens cases with me in my own personal home stash, and I keep normal saline as well to help with cleaning contacts lenses. If you are someone who wear contact lenses, please be aware that you need to change out your contacts every 3 months. I want to say every 3 months, and then you want to take them out of the eye, away from the lens of the eye, every day, and you want to clean them with new saline. You want to clean them again with new saline, and then you want to change your contact lens container again at least every, let's see what it says exactly, every month. So you want to replace the case every month, it says. So this container came with 6 in a case. I'm down to the last one for myself. I usually wash my cases, soap and water, rinse them thoroughly, and then continue to use them on a regular basis. But the recommended recommendation from the manufacturer here says once a month. You want to throw a case away and start a new case. Your contact lenses, I want to say every 3 months, but do check with your office, your doctor's office, to find out the recommendation, or check with the manufacturer who makes your prescription contact lenses. Okay, so let's go to the next product that I have. I have Miracle Teeth Whitener, activated coconut charcoal powder. Okay, this product is a Miracle Teeth Whitening product, and it is a powder, and it's charcoal, um, pulverized charcoal, and it works by cleaning the teeth, getting down into the gums, causing the teeth to become whiter. The process is because it's an activated formulation containing other products, coconut oil extracts as well, and then it has peppermint essential oil in it. It's two which extracts as well. So you're using coconut oil, you're using peppermint oil to help with cleansing. And this product is by Ontel. Ontel Products Corporation, made in the United States. So check it out. Teeth whitening. Okay, and I got that from the pharmacy department, and I got it a few years back. There is an expiration date on it. So that I do have an expiration date on it. That's how I know it's been such a long time since I purchased it. So it's probably good that I kick this one out and purchase a new container of this. So do please be aware of the expiration dates of your pharmacy products that you keep at home. Also be aware of the containers themselves, making sure that they're away from sunlight. Make sure your prescription and your over-the-counter medications are away from the sun, away from bright light. Make sure you know the expiration date on your products. If they're expired, trash them out. Don't save them. Trash them out and purchase a new container of whatever it is. And do be mindful that keep away from children, pets, cognitively impaired individuals, so that you may be able to go ahead and keep them fresh and keep them in a timely manner. I'll go through one more product for you before I close out the video. Thank you for joining me and staying this long in this video. Um, the next product I'll choose, let's see here. Okay, I know I pulled out some pain relievers. Diphenhydramine for allergy. Benadryl is another name, and it's 25 milligrams for sneezing, itching, sore throat, scratchy throat, running nose, itchy nose, watery eyes. Diphenhydramine is good as well. So try it out. Readily available, um, old school classic medication. And so I'm going to stop there, and I hope that I've been helpful. I hope that the information that I've shared in this video has been helpful to you in continuing with your home pharmacy. Take care. Dr. Erica, I'm signing off. Bye bye.